Welcome to Radiologists, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satish Krishna, and today our guest is the one and only Dr. Kate Hanneman. So Kate is an absolute trailblazer and probably the most sought-after person in radiology right now. For those of you living under a rock and who don't really know who Kate is, well, Kate's the Associate Professor, Cardiothoracic Radiologist at JDMI, the Joint Department of Medical Imaging. She has an appointment at Peter Munk Cardiac Centre, and she's also the Site Director of Women's College Hospital. So in this special episode, which is dedicated to the International Women's Day, our topic of discussion for today is women in radiology. What are the challenges faced by women in radiology? Is gender bias and wage gap, is it a myth or an epidemic? Is radiology the right career destination for female medical students? And are women better doctors than men? To know answers to these and more, stay tuned. Kate, it's great to have you in the studio.
Thanks so much for having me. I hope I can live up to the hype. This is such an incredibly important topic, women in radiology, and obviously near and dear to my heart. So it's my pleasure to be here today.
All right, let's just jump right into it. There's been a lot of discussion these days about EDI and diversity. What do you think are the benefits of a diverse physician population in healthcare, specifically gender diversity?
I think this is such an important question, and I'm glad we're tackling it head on. I think the benefits of a diverse workforce, including in radiology, can't be overstated. I think it allows us to provide better patient care, and ultimately that's the bottom line. That's what we should be aiming for. It allows us to provide care that is more appropriate for our patients depending on their background and their gender identity. But it also gives us unique perspectives in terms of our own backgrounds and our own health concerns that we may be bringing into our experience. But I also think it allows us to look at medical issues and our interactions with our colleagues and our trainees from a different perspective. So the bottom line is, I think having a more diverse workforce, including gender diversity, as well as diversity in training experiences and backgrounds, is overall a very positive benefit to our departments.
That's pretty interesting. So you highlight that this is important not only for the diverse patient population, but also to bring diverse ideas into a group. So do you think that women have a different approach to patient care than men?
Well, that might be a loaded question, but I'll tackle it as best I can. I think we all bring unique perspectives, and I think recognizing the uniqueness that we all bring and our different strengths and also our weaknesses is important, both for ourselves and within a department. And I think having a department that has people with different strengths and different skill sets is really important. Nobody can do it all, even myself. And I think it's important to know that and to find people to work with, either clinically or to collaborate with in a research department who have complementary skill sets for patient care or for research or for education, for example. And so I do think women in general might bring some different perspective to how we mentor, for example. And we know that having mentors and the ability to work with people who look like you or you might identify with is really important to encouraging more women to go into radiology. And so this diversity, is so multifaceted. It touches patient care, as we talked about. It touches our ability to encourage others to pursue our specialty. And I think it also helps us excel in whatever kind of domain we're pursuing in academics or in clinical medicine.
Yeah, it's interesting because quite a lot of data shows us that women may potentially be better physicians than men. For example, data shows that women on general spend 10% more time with their patients because they are more empathetic and they are better listeners. And the other thing which was interesting is one of the recent papers from our own group, which shows that the error rate of female radiologists was about 20 to 30% less than male radiologists, which shows that there might be a fundamental difference in which women approach healthcare compared to men. So one of the biggest successes in this, because as I just told you, women may potentially be better physicians, is that in the current day and age, the number of female medical students actually outnumber male medical students, both in Canada and the US. And I think that this is a huge step in the right direction. However, one statistic which is still lagging is that women are underrepresented in radiology practices compared to the rest of the medical curriculum. Why do you think this is? Are there any misconceptions about radiology which detract women from the specialty?
So much to unpack there. And I think I'll start with the last thought on the gap between the slightly larger proportion of women graduating from medical schools currently, which has improved, of course, over the past decade and 2 decades and is wonderful to see. But we're obviously lagging in getting and encouraging women to go into radiology. We're also lagging in having women radiologists who start in our residency programs progress to more senior leadership and academic positions. So there's an even larger gap at chair positions, for example, or division leaders. And so that is another, this leaky pipeline goes all the way along. And we need to not only think about getting women into radiology residency programs, but how to encourage and lift them up and support them as they progress up, the leadership chain or academic promotion, whatever path they may be on. And I think one of the major issues, to loop back to what I touched on before, is this issue of mentorship and having someone to sponsor you and having mentors that might look like you, or seeing senior women in positions of leadership and feeling inspired and supported, and physically having someone, speak your name and put your name forward for different positions. And of course, here at UMIT, we're so lucky, our division radiologist in chief is a woman and is incredibly inspiring. And of course, I've had the pleasure to work with Dr. Schmidt over many, many years, previously as the division head for cardiothoracic imaging. And so that's obviously incredibly fortunate for me and other women in our department. But I have other female mentors who have inspired me all the way from the time when I was a very junior resident, encouraged me to go into cardiothoracic imaging, for example. And so I think that is one of the key pieces. We can have formal programs to encourage mentorship and to connect more senior women in radiology with female medical students, but some of this is also, happens naturally and happens more informally. And some of those connections that we might forge can be really valuable. But we have to give people those opportunities, allow them to network and allow them to have those interactions. There was one more thing that you touched on that I think is really important. And I just wanted to highlight this double-edged sword of women spending more time with their patients. So that doesn't translate as directly to radiology in terms of the time we spend with patients in, an exam room, for example, but it does in terms of perhaps the amount of time we spend reporting, or the amount of time that women in general, and again, this is, on a broad level, not on an individual basis, might spend doing administrative type things or educational projects which aren't well remunerated. And we know that even in an academic environment, there's no great mechanism for recognizing that work. And so this is a double-edged sword. Yes, that might lead to better patient outcomes, particularly if we're spending more time in the reporting. But on the flip side, we also know it's true that there's a gender pay gap. And this is something I've been working on with an outstanding female medical student at the University of Toronto and other colleagues. But we need to recognize this, that if we spend more time in a fee-for-service model where some of these other pieces of work that we might do in our day that add value and they may improve patient care don't necessarily get translated into either recognition formally in our academic environments or higher pay. And so it is a double-edged sword. And that's perhaps something we need to think about. How do we flip that on its head and either say, well, if we're going to do things that improve patient care, how can we recognize that appropriately?
That's important that you highlighted the role of mentors, especially mentors whom you identify with, or strong female role models. Because I think more and more people are starting to realize this. Because when I realized when I was young, for girls and women, it was just the Disney princesses, and then you had the superheroes for men. But now the script is changing, and even in art and movies and all of the medium, you have strong female role models all over the place to pick from. And it's absolutely important, as you said, to have such strong female role models in healthcare, in medicine, and in every specialty for people to always look up to, as well as to be mentored along the way. And that brings me to the next question, which you kind of brought up in terms of the wage gap and the gender bias in medicine. So gender bias or gender stereotyping is very interesting, especially in medicine, because some people have actually called it an untreated epidemic. There is a very famous story in which there is a guy who's working as a tech support person, but one fine day when he's replying to emails, he's getting rude replies back. And he doesn't understand what the source of that is until he realizes that he's mistakenly using a female coworker's email and he's signing off with a female name. And what he was saying is that, like, stuff which I would have done in my sleep, it took me twice or thrice as long to convince people to kind of be confident in me and just follow what I'm trying to tell them to. And I think that quite a lot of my female colleagues have told me that the moment they walk into a room, they automatically assume that they're a nurse or they have less confidence than a male colleague. So have you faced any of such issues in medicine overall? And in that aspect, do you think is radiology better or worse than the average medical practice?
Those are tough questions, important ones, but really tough ones. I'll take a step back to when I was thinking about what to apply for residency and share that I thought all the way along in medical school, I thought I wanted to be a pediatrician. And this is relevant because I had a very pivotal moment actually working with a fantastic radiologist who's now one of our colleagues and partners, Dr. Jaffer, who really inspired me and opened my eyes to the possibilities in radiology. I thought radiologists sat in a dark room and that was mostly for men and it was very technical and you needed to be a physics geek, and none of that, what I just described, which isn't true, appealed to me. And I did an elective with Dr. Jaffer, and he's obviously such an inspiring person in so many ways. And I realized that's not radiology at all. But if you're not exposed and you think, or what you see is this picture of mostly older men sitting in a dark room and reporting by themselves and not talking to anyone, that didn't align at all with where I thought my medical career would go or what I thought I wanted in my life. And so I think really allowing people to see what radiology is really like is so important. And one of the things that happened when I started telling people I'm going to apply to radiology rather than pediatrics, and this was relatively late in the game, was people made very gendered comments. And I look back on these now and I'm so horrified, and I hope that now, several years later, no one would make these comments to young women, but things like, but you're too bubbly to be a radiologist. Do you really want to sit in the dark? Do you really want to be in a residency with mostly men? Like comments that are so horrifying to even think someone would think these things and yet alone say them to someone. And they really had an impression on me. Obviously, it didn't deter me from the path that I chose, and I'm so happy I chose that. Pediatrics is obviously wonderful, and I like to think I would have been a good pediatrician for all the reasons that were outlined before. But radiology, really has been such a wonderful career for me. And so I think this gender bias, to get back to the question you were asking me, is so pervasive. And sometimes we don't think about it. It's truly the unspoken and hidden curriculum where people think, well, you're a young woman or you're warm and bubbly or you have a certain personality. And so, you'd be good for pediatrics. And I think subconsciously I had, taken all that in over the course of medical school and thought, yeah, like that is the right path for me. And then when you take a step back, you can say like, my goodness, I have this world of opportunities and I could choose whatever path I want. And I don't have to go down the path that someone thinks is right for me based on these gender stereotypes.
It's very important that you bring up, Kate, that unconscious bias, because the biggest trick the devil ever pulled was to convince the world that he did not exist. And we can't fight stuff which we don't really know exist. The other misconception about radiology is in its name, radiology. And I think that there is a misconception, and that partly deters some people in taking the specialty as well, because it is associated with radiation. And the timing is absolutely awful, because usually by the time you're in residency or you're starting your career, that's when you're also starting a family. And I think that's why we are trying to move away from radiology into medical imaging to avoid this misconception that radiology has to do with radiation and that's going to be problematic, where we know that it really isn't. But moving to the other aspect I was talking about of starting a family, how do you think that affects the career of women, not just in radiology, but in medicine as a whole? Because you're often trying to start a family at the same time. And quite a lot of people would say that, hey, that's true for men as well. But we all know that the role of women in that beginning phases of a family is disproportionately higher. And at the same time, you're trying to start and balance a career. So what are the challenges faced by women there?
This is such an important question, and one that I have recently grappled with. I have 2 young children, as you know, and I chose to start my family, along with my husband, of course, after I had started my staff position. And the one thing I want to say to anyone who's listening or is thinking about it is there's no right time. And I would encourage everyone to think about not delaying, because there is no right time and there's nothing that necessarily makes it easier. There's challenges at every phase in your life. And as you said, there is challenges unique to women, particularly in the postpartum period, and some challenges even with working late in pregnancy if you work in interventional radiology, for example. And those are, of course, unique physiologic factors. But in general, you're right. The challenges of being a parent and having young children are not necessarily unique to women. They also hopefully apply to the fathers and the other parents and caregivers in our life. And there are ebbs and flows to this. It doesn't, I haven't found that necessarily it gets easier over time, but the challenges are more unique. I was sharing with a friend earlier this morning how my 4-year-old woke up this morning and was so cranky, and it took everything in me just to get her dressed and out the door this morning. Whereas yesterday, she woke up joyful and warm and bubbly, and it was so easy. So you never know what you're going to get. And I think those are the challenges, but the joys of parenthood. And for me, it's been so rewarding. Balancing that with an academic career, and as you know, I spend a large portion of my time being a clinician investigator and focusing on research, is absolutely challenging. And one of the things that we've had to grapple with in our family is how to manage the travel for conferences. And now that they're mostly in person, and trying to find and carve out, 3 or 4 days to go to a conference and present, which is really important to have visibility in your career, but also to disseminate your research and support your trainees. And there's absolutely value in that. But that time away from your family when it's, consolidated in several days at a time can be really challenging. And so I don't know that I have an answer. I don't think there is some sort of magic bullet or pill that's going to tell someone how to balance work and family, but you work at it, you figure it out. And if you do something that doesn't work, you take a step back and reflect on it and try to do something different the next time. And that's how I've really approached it in our family.
In life, there's never the best time to do anything. You just begin and hope for the best. Keep your fingers crossed, I guess. But the important thing which you are highlighting is academia. And although the number of female physicians is almost the same as male physicians these days, there is a significant difference in academia. Multiple studies have shown that the number of first authors, the number of senior authors in publications are disproportionately men. And during the time of COVID, there was a decrease in authorship, but the decrease in female authorship was disproportionate compared to male authorship. So what are the unique challenges faced by women, and why is there a barrier to entry into academia or barrier for women to be successful in academia?
That's a big question. I definitely don't have all the answers, but I'll share my thoughts on what I've learned along the way, along my path. And I will say, taking a step back, that I think there are gender biases that are specific to research and women in research and radiology. And one of the unfortunate things that I was told, not in so many words, when I was starting my career and I was interested in research and I was thinking about doing a master's, which I did, of course, during my first few years as staff, was someone conveyed to me that, well, research in radiology, it's mostly technical and, that's kind of where radiologists do a good job. And I had been interested in more clinical research, which is ultimately what I've pursued after doing a master's in public health and epidemiology, and, was somewhat discouraged, or someone was trying to steer me in another direction because the sense that, well, in radiology, we don't really, quote unquote, control the patients. And this kind of clinical research where you're actively recruiting patients can be really challenging. And I have to say, getting back to our thoughts on parenthood and starting things, sometimes you don't know how to do things. You don't know where they're going to go. You don't have the answers, but you just jump and you take a leap of faith and you do your best and you learn along the way. And that's sort of how I think of parenting. You have no idea what you're doing in the beginning and you just do it because someone's depending on you. And I also feel like that is analogous to my research career. I just thought I saw someone who did the master's that I ultimately completed. I saw what doors it opened for them and, the skills. I knew what I wanted to learn. And it's a bit of a leap of faith. And then you sort it out along the way. I think for people like myself who like to have a plan and like to plot things out in advance, those kinds of decisions and leaps of faith can be hard to do. But ultimately, they have all paid off so well in my life that at some point you just got to act. You have to stop thinking and stop planning, and you got to do. And it doesn't always turn out how you think it will, but sometimes that's the beauty. How it turns out is better than what you could have possibly imagined.
Yeah, the leap of faith. I think that's the most important issue. And probably that's the most important barrier, because I still remember the first time I was in front of a swimming pool and I had to just jump in and I was just standing there. And I can understand what a scary moment it had to be. Now, what makes it less scarier is seeing other people jump in. And then you're like, oh, it's not a big deal. And this brings everything full circle, because I think the problem in academia, the problem in medicine, the problem in radiology is that women don't really see as many other women jump in. It's due to the lack of strong role models or lack of strong predecessors. And there is this hesitation. But I think that people like you are doing an awesome job of kind of breaking those molds. And I think you're going to inspire a legion of women behind you. And this also brings to how to structure programs well. And as you pointed out, Heidi is the chief. And I think in workplace, multiple focus groups have shown that to have a successfully diverse workplace, one of the prime things which has to be emphasized is flexibility, because the needs of different populations are slightly different, and flexibility has to be emphasized if we want to ensure a truly diverse workforce. And in that regards, what are your thoughts on radiology? How flexible or inflexible do you think radiology is for women in their careers?
I think it's incredibly flexible. And this is something that I didn't fully grasp or understand when I was a medical student making the decision, but has been so fortunate in my career. So part of the flexibility in radiology is that we have the ability to report things and then sign them off. And the next day, someone can tackle the list that is completely separate and independent of us. And so this allows us the flexibility to, for example, take parental leave and not have to struggle necessarily to find a locum. Of course, the work needs to get divided among your division or however that might work. But within our structure in our department, this has given people the flexibility to take leaves, for example, might even allow people to take sabbaticals without that burden of having to find coverage for your patients in a clinical practice. I also think the flexibility can be thought of more on a day-to-day level where, for example, I have 2 clinical days per week usually, and the rest of the time I spend doing research. And that's a great balance for me, allowing me to be in the clinical world and really understanding what's happening, but also to truly step away on my non-clinical days and focus on research or focus on doing podcasts or whatever I might be doing on those days. And so we do have a lot of flexibility. We also, of course, have the flexibility to work from home. And that's something that I think medical imaging and the community at large has really embraced during COVID. We learned, okay, we can report from home in some cases. I don't think that should be every day on clinical, at least not in an academic department where there is a clear benefit to seeing people and interacting with our colleagues and interacting with our trainees. And those human-to-human connections are so important. But there is a benefit every once in a while or on certain rotations to allowing people to work from home and therefore spend the time that they would have spent commuting with their families or doing research or whatever. There's always a trade-off, of course, but I think that flexibility is incredible. And our department has really excelled in striking a balance.
The culture of work and flexibility comes from having strong leaders. And it's great that JDMI has been able to inculcate all the positive aspects. And it's interesting that you mentioned this because in our last episode with Dr. Zhao Yang Liu, she also kind of touched upon the same thing. And for those of you who haven't heard the last episode, please, that was a very interesting topic as well. And I wanted to ask another question on the same line, because you're now juggling a lot of responsibilities. You're the site director, you're a researcher, you have clinical work to do, and as you mentioned, you have 2 kids as well, and a family life, and a very active social life. On top of that, going to all these conferences. And when we tend to divert our attention to so many different things, burnout has been very rampant, especially with people who are everywhere all the time. So how do you balance that? How do you prioritize well-being, or how do you deal with burnout?
Again, such an important question, one which I don't have the answers for everyone. Sometimes I don't even have the answers for myself, but I think it's important to think about. And I think during COVID, we talked a lot about wellness and burnout. And for myself, I've recognized, the things that bring me joy and bring, for lack of a better word, energy back into my life are the interactions with people. And so during the pandemic, being, isolated, I was actually on maternity leave when the pandemic was declared, was such a disorienting time for everyone, of course, but also felt very isolating because I was alone. I could see or hear or read about all the things happening in the hospital and felt very out of the loop. And for me, that was actually a catalyst to do something different, to think about, well, I can't sit here and wallow and be alone because that's not good for me. So I started working on research and I started working on grants. I fit it in whenever I could. It was maybe 5 minutes here or 5 minutes there. It wasn't like a nice, big, juicy chunk of time where you think about, I'm going to sit down all day today and write a grant. It wasn't like that at all. But it worked out. There were lots of calls for grants and funding opportunities for cardiac and cardiac imaging related to COVID really early on. And I realized that if I waited until my mat leave was formally over, I would have missed that wave. And so I pivoted a bit and refocused and got help at home and was able to capitalize on that. So I think for me, wellness is thinking about the things that bring joy and bring energy back into your life and finding the time for them. The finding the time part is not easy. It doesn't, just snap your fingers and find the time. But there's definitely been a period in my life over the past couple of years where the priorities in my life have been my family and they've been work. And work includes both clinical and research and mentorship pieces. And you got to kind of fit those pieces of the puzzle in while, remaining healthy and finding time to exercise whenever you can. And of course, sleep enough. And I always joke, I probably don't sleep enough. So don't listen to my advice in that regard, but you somehow make it work. But you have to think about what parts of your life bring you joy and are most important to you, and you prioritize them.
I think that's one of the most important aspects of dealing with burnout is to be able to have a conversation about it. Because in the days past, the idea of a strong or successful person was somebody who wasn't affected by burnout or wasn't affected by anything negative. But now we realize that's not the truth. Everybody is human. And the more we speak about it, the more we are able to handle it better. So to those who are listening, when you hear Kate talk about her struggles with managing everything, you need to remember that she has the most cited radiology publication of last year. And she has numerous grants to her name. And then you understand that such an extremely highly successful person still has challenges balancing everything, and that is completely human, and that it is normal to be human. So I think these are the kind of people we need to turn to advice to, because they have gone through the struggle, they understand what it is to be human. And so Kate, what is your advice for female medical students? And how do you think that exposure to radiology curriculum should be changed or increased in medical school? And what is your advice on aspiring women in radiology?
Thank you for the kind words, first of all. And I just want to highlight that the paper that you mentioned that was the most cited in radiology in 2022 was a trainee project. And this was something I worked on with one of our fellows. And I think it's always important to acknowledge and support and lift up our trainees when they did the heavy lifting. And that ties into mentorship and supervision and bringing up the next generation of medical students or radiology fellows and finding the time to invest in them and allowing them to succeed and then shining the light on them ultimately. To get back to your question about how do we encourage more women to go into radiology? How do we encourage medical students in general to consider radiology when there are these background and pervasive concerns about AI replacing radiologists or creep from clinical specialties into areas of imaging? And I would just want to leave everyone with the thought that I think the future of medical imaging is incredibly bright. We have left the sentiment of AI replacing radiologists. That is not even kind of in our dialogue anymore. Now I think the appropriate thoughts are, how will we use AI to help us? How will AI help us provide better care or faster care or allow us to have time to do other things? How can we work with our clinical colleagues to bring the best patient care or do the best science rather than thinking about us versus them? That is in the past, and we should leave it there. And we should move forward, forging these strong collaborative relationships with people. So I would tell all the medical students, this is honestly the best specialty. It has to be the best for you, but it truly has been the best for me. I am so happy with the decision I made. And the future is incredibly bright in medical imaging. It is broad. As we heard before, it's not just sitting in a dark room looking at radiographs. That is such a small and actually decreasing slice of what we could do in medical imaging. So ultimately, I think the best thing to do is to try to find a mentor, someone you identify with. If you're a female medical student, hopefully you can find a female mentor who has a career path that you might want to emulate or might want to emulate's not the right word, who has a career path that you might want to look up to or inspires you. And you, of course, need to create your own path. But ultimately, I think those relationships with people who are further along and more senior are what hopefully will inspire you to choose the specialty as your career path.
Well, that was truly inspiring. If your speech today, if people hear this, and if that convinces one female student to take a career in medicine or one female medical student to take a career in radiology, I would think that the aim of this podcast was well accomplished. Before we sign off, there's one other thing I need to remind you. In terms of radiology, maybe statistically there are less, but in terms of this podcast, radiologists, we're actually doing an incredibly amazing job because this is the 5th episode and Kate is the 3rd female radiologist to be here. And for everyone listening, the next episode, or the 6th episode, is also by another female radiologist, Dr. Anya Keeler, who is going to be the upcoming president of the Canadian Association of Radiology. So stay tuned for that. Ladies and gentlemen, that was Dr. Kate Hanneman, Associate Professor, Cardiothoracic Radiologist, Site Director of Women's College Hospital, and me, your host, Satish Krishna. See you on the next one. You were listening to Radiologists, a podcast by University Medical Imaging Toronto, the largest medical imaging group in Canada. Produced by Ina Levchuk. Learn more about us at universitymedicalimagingtoronto.ca and follow us on social media at Imaging Toronto. Thank you, everybody. See you on the next one.